Again, my name is Marcos Arreta. I am a nursing student at the Catholic University of Santiago from Wake, and today I'm here to talk about a randomized controlled trial of liraglutine for adolescents with obesity. Definition: obesity is a chronic and progressive disease. More than 70% of people who are obese before puberty will also have obesity in adulthood, underscoring the need for effective and long-lasting intervention with adequate safety profile. In the early stage of the life, in pediatric patients, the first-line treatment for obesity is usually lifestyle therapy, which often produces poor results response. Therefore, an alternative in liraglutine, which may be useful for weight control in adolescents with obesity, is increase the glucose-dependent postprandial insulin level, reduce glucagon secretion, delay gastric emptying, and induce weight loss through reduce appetite and energy intake. Nursing application: nursing personnel fulfill different functions in this state of treatment in order to be able to modify the patient lifestyle. With this intervention are counseling on healthy nutrition and physical activity to lose weight in addition to the administration of liraglutine 3.0 mg or placebo of equivalent volume administered subcutaneously as a day for 56 weeks, followed by 26 weeks of follow-up without treatment, but with the measuring of various parameters such as glucose control, blood pressure, and quality of blood life. Finally, the nurse performed the standard control of the ANC to identify if there was a change when the treatment was applied.
The quick guide for Victoza pen. Start with checking the pen label to be sure that it is your Victoza pen. Prepare Victoza pen. Attach a new needle. A Novo fine needle, screw this straight and tightly onto the pen. First time you use a new Victoza pen, check the flow in the pen with an air shot. Turn the dose selector until the flow check symbol lines up with the dose pointer. Tap the pen gently a few times to make any air bubbles collect at the top. The push button all the way in, and make sure that a drop appears. To start dialing, make sure that the dose selector is set at 0. And select the number of milligrams you need to inject. Adjust the dose by dialing up or down if necessary. The needle into your skin. The push button all the way in to inject your dose. After injection, leave the needle in the skin for at least 6 seconds. Remove the needle after every injection to ensure continuous, painless, and accurate dosing. Then put the pen cap back on and store Victoza pen at room temperature until your next injection.
Pros and cons. Pros: treatment that help modify the nutritional status of the patient. Cons: hypoglycemic episodes, gastrointestinal adverse effects such as nausea, vomiting, and diarrhea. Research: trial under development for its application in treatment against obesity in adolescents. You should apply in Ecuador. The therapy approach to obesity poses several challenges, particularly due to the difficulty of losing weight and maintaining it over time, which determines a high rate of weight loss and weight regain. That apart from the fact that most of the time there is no proper care from the ideal professional, in which diagnostic and therapeutic advice for obesity in daily practice in a rate scar. In Ecuador, there is no record yet of the application of the treatment so far, which is why conventional treatments against obesity in adolescents continue to be applied.
Dosify 103.6 is a combination of insulin degludec, a long-acting human insulin analog, and liraglutide, a glucagon-like peptide-1 receptor agonist. Zoltify 103.6 was developed by Novo Nordisk to bring together the mechanisms of actions of both monocomponents. Formulation is possible due to the molecular properties of these analogs, which allow the formation of distinct and stable structures, with the insulin degludec existing as soluble dihexamers and liraglutide as soluble heptamers in the pharmaceutical formulation. Following subcutaneous injection, the additives disperse, triggering the two molecules to undergo different mechanisms of protraction. Liraglutide retains its heptameric structure, which prolongs absorption from the injection site. In addition, its fatty acid side chain allows for reversible binding to albumin in the bloodstream. The fatty acid side chain and binding to albumin also increase resistance to degradation by DPP4, modifications that prolong the plasma half-life of liraglutide, enabling once-daily administration. In contrast, back at the injection site, a depot forms as phenol diffuses away. Insulin degludec dihexamers assemble into soluble and stable multihexamer chains that do not interact with liraglutide. From here, zinc diffuses, and the individual insulin degludec monomers gradually separate from the ends of the multihexamer chains, and slowly and continuously exit the subcutaneous depot into the circulation. In the bloodstream, the monomers bind strongly but reversibly to albumin. Once absorbed into the circulation, insulin degludec and liraglutide work at different target organs to lower blood glucose in a complementary manner. In the pancreas, liraglutide has effects on both insulin-producing beta cells and glucagon-producing alpha cells. Liraglutide monomers bind to and activate GLP-1 receptors to stimulate glucose-dependent insulin secretion from the beta cells and suppress glucagon secretion from the alpha cells, with the resulting overall effect being lower fasting as well as postprandial glucose levels. In the meantime, at the insulin target tissues such as liver, muscle, and fat, insulin degludec monomers bind to and activate insulin receptors. The blood glucose lowering effect of insulin degludec is primarily due to the uptake of glucose by muscle and fat cells following the binding of insulin to receptors, and to the simultaneous inhibition of glucose output from the liver. Phi 103.6 brings
Conclusion: in obesity of adolescent, the use of liraglutine plus lifestyle therapy led to significantly great reduction in the ANC standard deviation score, as well as being effective in improving glycemic control. The pharmacokinetic properties of liraglutine in this population were consistent with those in obesity adults and indicate that the dose and dose escalation regime recommended for weight control in adults will result in a range of exposure in adolescents. The higher frequency of gastrointestinal adverse reaction observed, which liraglutine subjects that this treatment might not be suitable for all patients. Thank you for attention in the exposition.